Hello, CFB-ISD. My name is Sandra Lieck, and I'm the Director of Health Services here at Carrollton-Farmers Branch ISD. Plans for the upcoming school year are well underway. Our focus is to provide a safe and healthy environment for students and staff when we return to the classroom. Here are 3 frequently asked questions about CFB-ISD health protocols. If a teacher has 5 classes a day with 30 students each, do all 150 of those students need to then stay home and quarantine for 14 days? I'm assuming if the teacher tests positive, do all the students now have to be tested? Will the testing occur at school? How will the parents be notified? The answer to these questions are our local health authority will guide us in the decisions regarding quarantining of students and staff. Resources for testing will be provided for families. However, testing is not available at school at this time. Parents and staff will be notified of positive cases through our electronic health system in accordance with TEA guidelines. This question highlights the need for all of us to engage in social distancing, wearing a mask, and good hand hygiene. An additional measure that may be employed is the cohorting of students to ensure that student and staff groupings are as static as possible. This is accomplished by having the same group of children stay with the same staff all day for younger children and as much as possible for older children, and limit the mixing of groups if possible. When a person tests positive for COVID-19, the need to quarantine is determined by contact. So these measures to limit contact are helpful. The CDC definition of contact is someone that spends 15 minutes or more within 6 feet of the positive case without a mask. If staff and students are practicing the safety measures recommended by the CDC, they will be less likely to be considered a contact and then be required to quarantine. I acknowledge the classrooms may be relatively confined spaces, so other measures may need to be employed when social distancing is unable to be maintained, such as physical barriers, like plexiglass, and physical guides on floors to provide spacing and one-way routes to minimize the contact between staff and students. Another question received is, what if someone lives in the same house as a teacher who tests positive? Does that teacher now need to quarantine for 14 days before returning to work? The answer to that question is, if a staff member tests positive, he or she will have to meet the following criteria to return to work. They must have 10 days since the onset of symptoms, a marked improvement of symptoms, and be fever-free without medication for a minimum of 24 hours. CFB-ISD nursing staff will also conduct a phone interview to perform contact tracing and another symptom interview before the employee returns to work. How will it work for substitute teachers who teach in multiple schools? What if they are diagnosed with or have been exposed to COVID-19? What measures will be taken? The answer to this question is, this is a challenging topic. It will be especially important for our substitutes to monitor themselves for symptoms, to follow the safety guidelines being put in place, and to not come to work if they are feeling ill. We appreciate your patience and understanding as we look to safely start the 2020-2021 school year. For up-to-date information, please make sure to visit our website at www.cfbisd.edu.